Global leaders should invest in supporting research that generates information from communities, with communities, about what works best to boost their demand for vaccination and their uptake.
When it comes to vaccine acceptance, a lot of the conversation is dominated by vaccine hesitancy, often placing the blame on individuals and communities who are not coming forward to take the vaccines. However, the work in our research shows the opposite. The people from the communities that are under-vaccinated are willing to take the vaccines, but there is a lot of mistrust, misinformation.
That we need to be not only innovative, but we need to continue to bring the vaccines closer to the population where they are, whether it's door-to-door vaccination, whether it's vaccination at workstations, whether it's vaccination at religious gatherings.
The informal healthcare worker, which were ignored the most, they were the one help us the most, and they were the one mobilize the whole community and make and generate the demand of vaccine and make the people to accept the vaccine.
If you don't strengthen the trust in the institutions and in the healthcare workers, how do you expect that vaccines can be properly delivered? And how do you expect to increase the vaccination coverage? So instead of creating short-term solutions, we need to think in long-term structural solutions.
To increase the vaccine uptake, I would request the global leaders to involve a community member from a marginalized community.
I would like to call about more involvement of nurses in the public health sector, mainly in the vaccination program, because they have more closest to the local communities and because they will make a huge impact when they need the programs.
There's no one size that fits all. What could work in the north could not work in the south. So we need to really start working together with these communities, identify trusted people in these communities to work with.
Governments, policymakers need to make sure that everyone has access to vaccine, regardless of where this person stays or even lives, regardless of this person's social standing.
You would like every child, every adult, every youth that is eligible for a vaccine to receive it and benefit from the most of the vaccine, to drive those benefits, because the vaccine saves life.